Hi, everyone. So excited to have you all here today. Today we have with us Greg Henriksen. During his 40 years in the field of psychology, his work has been able to provide clinical service. He's been conducting research, has directed psychology internships and fellowships programs. He has also contributed to public policy and has had leadership roles in professional organization. And he also has recently written a book, Assessment and Treatment of Older Adults, a guide for mental health professionals, which was then published by the American Psychological Association. And today he is here with us to discuss coping with COVID and all the things that have been coming up. So I'm excited to have you here, Greg.
Well, hello, audience out there. Good to not good. It would be nice to see you. um, so, Kara had asked me to talk about coping with COVID. That's a somewhat humbling request in the sense that we're all dealing with this, and I don't feel like I'm the person who has the answer, but I have some ideas, and I also, have sort of thought about this in a way that maybe it helps clarify some of the issues that many of us have been going through. First of all, I'd like to acknowledge that I know that some of you in the audience have been affected by COVID in one way or another. Some of you may have contracted it or had family members who've had it, or maybe even lost family members who've had it, and I want to express my sympathies for that, and acknowledge that this is something that is not just them, it's us in a way that's become very personal. I think particularly around the country as time has gone on, it's been a pretty wild ride for all of us here. So I've been in the aging field for 45 years. My first job out of college was as a door-to-door social service outreach worker visiting older adults in the Fenway neighborhood of Boston, where I learned my first major lesson in gerontology, which is that most older adults are really remarkably resilient, a lesson that I've continued to learn throughout my long career in aging. I actually turned 70 in 2 months. And so I was at a presentation a couple of years ago, and the presenter said, "We've been working on the elderly so long, we are the elderly." So I would just say my long career in aging has been really so gratifying and so interesting, and hopefully has prepared me a bit for my own later years. So I live in New York City. I moved to New York City in 1977 to start graduate school. And living in this large metropolis, I might hasten to add, I grew up in a small town in the Midwest. My family says, "How did you end up there?" But having lived in New York, when I first moved to New York, before I moved here, there was a mass power outage with looting. There was a guy named Son and Sam who was killing people in New York. During the time I've been here, there have been other power outages. There was the AIDS epidemic. There was the first World Trade Center attack, and then the second World Trade Center attack, Hurricane Sandy, which really devastated New York. So as a New Yorker and as a member of this larger city, we're not immune to dealing with major events that are not just you read about in the newspaper, but actually you're in the middle of it. So I think New Yorkers consider themselves a pretty hardy bunch, and I think we are. But this COVID thing is new. It's a different kind of threat that I think is different than many of the things that we have experienced here in New York, and thinking more broadly about the country, different than anybody had ever anticipated. I don't know if I'm sure some of you watch public television, and there's a series called The American Experience a couple of years ago, and there was a documentary on the flu pandemic of 1918. And I remember watching that. It killed 50 million people around the world. It had a terrible impact on the country, and I kept on thinking, I'm so glad that I live in an age where that kind of thing will probably not happen, only now to be in the midst of it like all of you to this thing. So for living in New York, and I know that many of you don't live in New York, it came on quite suddenly, right? And in my diary, my daily diary, I wrote on March 17th, coronavirus becomes real. And it was different than the other things that have happened here because it wasn't circumscribed. It wasn't an attack. It wasn't an event. Of course, the AIDS epidemic was something that continued for a long time and has continued to affect people. But it was sudden. It was real. It was unanticipated in any way. And so, living here, we were the first people to deal with this. For the rest of you in some parts of the country, this may have seemed very remote. Oh, it's over there in New York, right? Now, most of my siblings live in the Midwest, and I remember calling them and saying, there's something terrible happening here. You have to be really careful. You're not immune to this. And and then, it was sort of like that seemed a little alarmist. But I kept on saying, you really have to be careful. This can affect you. And then we saw what happened. This thing has spread around the country in a way that there's no denying of what is happening. And living here in New York, there's been no denying of it. In March, the Manhattan streets. I live in the borough of Manhattan, which is the part of New York where the Empire State Building is, and a lot of things that people associate with New York. The streets were eerily empty, and they were quiet except for the ambulances taking people to the hospitals. The media coverage was unending, right? You heard it. For those of you who don't live in the New York area, or some other parts of the country that hit first, it was over there. I remember when the refrigerator tractor trailer morgue appeared in my neighborhood. That probably was the most startling event, to realize there were so many people dying that there was no place to put them. And then as time went on, I had family members who got COVID. I work in a large geriatrics department. Colleagues started getting COVID. And then I had a couple friends whose older parents in their 90s died of COVID. So this has all been pretty mind bending, even for those of us in our lives who've gone through these mass events and being in the center of them. And then did it have to get any more complicated with all the political unrest, the social divisions and historical issues that have come up, some of them quite rightly so. But it got more complicated. So you all know that. I'm giving you my slant on it, but I think it's helpful to sort of point out how this is different, because in a way that it may help you to understand how you are having reactions to it that may be unique or for you, and then maybe some ideas of what to do about it. There's a German term, if I pronounce it correctly, for those of you who speak German, forgive me, it's called Zeitgeber. What does that mean? I was introduced to this concept in the context of some psychotherapy work. Zeitgebers are natural daily rhythms of our life. They're biological rhythms, they're social rhythms. Examples include, the rhythm of your eating and your sleeping and your daily routines, and most of us have routines, and they help anchor us. Well, COVID has totally shaken up, or at least partially shaken up, our Zeitgebers. So that kind of creates some sense of instability that we feel rooted by in our daily routines. For myself, uh, I gained weight. I think many Americans did. My sleep, which was pretty good, kind of got fragmented with kind of scary dreams. I was always a really good walker, not so much. Um, I'm a pretty sociable person. I love being with people. That wasn't very easy, and I noticed that my own mood became poorer. And I'm sure that for many of you that there are similar kinds of things. Um, what has happened here with this COVID pandemic has really hit on many areas that are known to increase risk for depression and distress. And one approach that I use is called interpersonal psychotherapy, which is a treatment for time-limited treatment for depression that's very effective. And there are four problem areas one or two of them can be a focus of treatment and psychotherapy. There are life transitions, relationship disputes, grief, and social isolation and loneliness. So thinking about this COVID pandemic thing, it hits all of those in one way or another. Our lives have transitioned in ways that we couldn't have expected. Um, you may have noticed, for some of you, that your relationships with other people may have grown more tense in a way that maybe it was always there, but it may have gotten worse. So you begin to see that people are having more potentially, and also more connection too. I hasten to add, but grief. Well, there are people that I know who have died, and uh, and then, getting back to how personal this is, I live in a large building in New York City. I have a neighbor I share a wall with. I've known him for 40 years. He died of COVID. He died of COVID. So this whole thing was so close. It was literally right next door to me. And this person who I've known for all those years, I I I grieve his loss as a familiar neighbor of all those years. Social isolation and loneliness, I hear a lot of that. And by nature we are as we quote social distance. It and some of us are feeling lonely and pining for more connections to people. Well, what is the emotional impact of all of this on people? um First of all, let's remember that some people come into this with pre-existing mental health problems. All right. um, and if community surveys are correct, at any one point in time in the United States, probably 20% of people have a mental health problem, depression, anxiety, substance abuse, and other kinds of things. All right. Mental health problems are not just other people; they can be all of us. Um, so somebody has that going on, and then you add this to it, right? Then there are people who always thought of themselves as in pretty good emotional and psychological shape, who are not finding that to be as solid as it felt before the whole COVID thing. So there may be some of you who considered you the bedrock of your family, only to find your the ground shaking in a way that maybe it has not that much happened in your life, right? In terms of this COVID things, there are a continuum of responses from subjective distress, right? Like, it just doesn't feel right. I'm feeling stressed out. To people who are having, in the mental health trade, we call elevated clinically relevant symptoms, which would be increased symptoms of depression and anxiety, that you could actually measure, right? And we're in the mental health field, we're always attentive to that, because sometimes people who have elevated symptoms of depression and anxiety can then go on to have, well, in mental health, we call it a disorder, right? So that is a more significant kind of thing. So we're seeing a range of responses to this, and for people who have pre-existing mental health problems, it could exacerbate that. Yeah, early in this pandemic, my professional association, the American Psychological Association, which has done community surveys of people's stress and distress in the community, found that the levels at the beginning of the pandemic were the highest they had been since the Great Recession. which was, of course, a very distressing thing to many Americans. And in terms of these elevated uh, clinically significant symptoms, usually they're about, oh, maybe 17% in the general community. They're double that now, and maybe they were at the beginning of the pandemic. They're basically twice as much as they had been. So if you're wondering why you're out of sorts, well, there's good reason why you're out of sorts. And we humans are tender creatures, I- and and so we interact with the environment. Our brains interact with the environment. We are creatures of our circumstances and our environments. And the fact that we would be emotionally responsive to what's going on around us, well, that's just the way it is, right? Um, and so I think it's important to keep that in mind, because I have people who were really quite distressed at what they're feeling and don't quite understand that what they're feeling is fairly common, and it's not evidence of some failing on their part, but the fact they're human, and that we have emotional response to the circumstances around us. Um, I also just have increasingly talked to people who said they're feeling lonely, right? By the way, most people assume that older adults are lonely. Well, in fact, rates of loneliness among older adults are actually lower than younger adults. And I think that's important to keep in mind, in part because of all the negative stereotypes about aging, which could be the subject of another talk. But with respect to loneliness, I thought, well, how do we define loneliness? And there's a measure called the UCLA loneliness scale, and I looked at the items in that scale, which I thought were very interesting, and maybe they speak to some of the experiences that some or many of us are having, as we're not connected in a direct way to the people who are around us. And what some of the things? Not feeling in tune with people around me, lacking companionship, no one to turn to, feeling alone, don't feel part of a group, don't feel I have a lot in common with others. I don't feel like I'm close close to anyone now. What are some other items in this? My interests and ideas are not shared with others. I don't feel like I'm an outgoing person. I don't feel close to others. I feel left out. My social relations feel superficial. So, um, so some people have some chronic feelings of loneliness for any number of different reasons, but there are situational things that can trigger feelings of loneliness, and which, for those of us who have felt there are times, I think, in many people's lives, they may feel lonely, and it's a painful kind of feeling. And I think that these days there are many more people who are feeling that in a way that they maybe not had felt it before. So it's not just sort of mental health kinds of symptoms, but it's this also sense um, of being in the world, in a way that you feel apart from it, which, given the fact that human beings are social creatures, that can be something that is very difficult. I've thought about, all the public health recommendations that you shouldn't travel, you shouldn't gather in groups, um, uh, and of course there are press reports of people doing that all the time. Public health officials don't travel over the holidays, and millions of people do. You have reports of young people in college who are told don't get together, and yet they do. And my thought is, that all makes sense, of course, people want to see their relatives over the holidays, and even though they know they quote shouldn't do it, they do. Can you imagine? I mean, for those who I don't know, maybe some of you are young on the call, but I think all of us can remember being young. Can you imagine how painful it would be to go to college and told that you couldn't spend much time with the people around you? It seems like almost an impossible request. And so I think this has been something that has been especially difficult. And thinking back to that documentary I saw on the American experience on the pandemic of 1918, all the things that we're seeing played out now were being played out then. You know, information that wasn't accurate, information that was perhaps not that was suppressed. People told to wear masks, but not. people 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 getting in protests that having to wear a mask was something that they didn't have to do, and they resented it. um, Hospitals that are being overwhelmed. So this is not new, right? And I think looking back in other circumstances, I don't know if there's any comfort to know that the pandemic of 1918 had similarities with this, but it really attests to the challenges for individuals and societies and families and communities to try to pull against what is their natural inclination to connect. And this has been so difficult for people. And I know it's easy to be judgmental, but I think it's equally hopefully it can be helpful to just understand why this has been so hard for everybody. So um, as part of what I do, so I'm a psychologist, and I work at Mount Sinai Medical Center in the Department of Geriatrics, um, which I'm very proud to be. It was the first department of geriatrics in the United States, and I have wonderful colleagues. They're the best. I say geriatricians who are medical doctors who specialize in aging. I call them the holistic doctors of our age. A really nice group of people. And so part of what I do is as in my role as a psychologist, I see older adults in psychotherapy who are part of our geriatric primary care clinic. So the doctors and the social workers will refer people to me, um, and so since March, I've been working from home. Um, and I've been working from home because my office mate, a geriatrician, said, "My friend, may I advise you that you may not want to come here if possible and try to work from home," which was very good advice. So I've been talking with people, some of whom I'd seen before COVID, and other people who I've seen as new clients of mine. So I thought I would offer just some general observations of what I've seen in my role as a psychologist. Now, the people who referred to me are a subgroup of people who are having mental health related problems and who agree to see somebody. So they're not representative of everybody, but it offers a glimpse into sort of what's going on. Because what I really like about being a psychologist with older people is I there's a greater latitude for talking about the way things actually are, rather than having to change your message to put on your best face. And so I've sort of I say I'm privy to the private lives of older people. And so it's always, sometimes it's another source of information to see what's going on. So what have I observed? First of all, I continue to be impressed, as I had in my first job out of college, of how resilient people are. In fact, if I were to conclude to draw a summary of my many years of working as a psychologist, I am less impressed with the problems that people present than I do with how hardworking most people are and how resilient they are to try to make things better for themselves. And I say that after many years of doing this. So what am I impressed with among people who I've now been seeing through Zoom? Well, first of all, the people were adaptive to this new technology in a way that I fully hadn't anticipated. Right now, for those of us who are older, I've gone through 20 iterations of the whole computer thing, starting as a graduate student. Having some of you may remember you would take data punch cards to a place and feed them in. Well, it's all changed. I've never liked any of it, to be perfectly frank. And now I'm on, the 20th version of whatever the computer stuff is. So I don't really like it, but I do it because I have to. But I've been impressed by how people who had really never done any of this stuff have made the effort to figure out what Zoom is or FaceTime is or other kind of platforms so that they can connect. It's not as if it was something they wanted to do, but they did. So people have really done that in a way that I think just attests to the adaptability of people. So my sense of this COVID thing adds a layer of complexity onto whatever else was going on in your life. Okay, so so what are the things? So among people I've talked to, what are some of the layers of complexity that COVID has added? I have a woman whose husband died just before the pandemic. So all of a sudden she's dealing with the death of her husband, and then she's home all by herself. Oh, trying to connect with people with other means. But normally people who are widowed or widowers have a period of time in which, people make more efforts to get together. There may be a memorial service or other. And we know that one of the tragedies of this COVID thing is that there are people who have relatives who die and they can't have a funeral. Well, although people do find Zoom related memorial services, things of which I've been on a few myself. So then other people are having pre-existing health problems. I don't know. I have patients who see a doctor almost every week for one thing or another. Now they had to do it virtually or by phone, or had to go in and get and be very concerned about whether by going out they could get yet another health condition. There are people who are with spouse or partners who are now have been in the same place, but normally they spent their days doing other things, and now they're with each other all the time. And they may not have always got along very well, but now it's even worse, right? What are other things? I talked to a woman who was just heartbroken because an important component of her life was that each week she would go several times a week and pick up her grandchildren from school and have an opportunity to spend time with them. She missed that so much, and she realized how much it undergirded her well-being. People who take part in community programs, you know, senior centers or church groups or whatever it is, just have found that they can't connect to those places, which were really in a vital and part of their about their normal rhythm and pattern of their lives. Then we have people who are sitting at home, um, who were maybe prone to regrets and rumination about things they should have done or they could have done. Now they got plenty of time for that. I've had people say, those thoughts were always in the back of my mind. They're in the front of my mind now, and they haunt me. Okay. Um, people whose older people whose adult children are either overly protective. Mom, you can't go to the grocery store. Mom, you shouldn't go outside. No, you can't do that. um, Sort of feeling ordered around by their children, who the presumed motive is to be protective, but in some ways is felt like that it's disempowering, um, or underprotective. I talked to a woman who said, my son and his family packed up, took the kids, and went outside of New York, leaving me behind. So there are people who have felt that rather than overly protective, they were kind of left behind. Now, I'm sure their adult children have their own explanation for things, um, but getting back to New York, in New York, which is about a population of almost 9 million, 500,000 people left. Usually there were people who had resources, but I just would say for someone who has stayed here during all of this stuff, I do have some mixed feelings about the people who picked up and left. Not that they couldn't do it or maybe they shouldn't do it, but in some ways, this idea of sort of feeling left behind, I can sort of get that. So what else do I hear? People are really bothered by the political situation in the United States. And although I never saw it as my role to talk with people about politics, right? You can't be ignored, right? And it's been deeply disturbing to people as part of the mix. People are challenged about what they thought the country was, um, challenged by what the country has turned into. That was not the country that they grew up in. Um, the A heightened sense of vulnerability among groups that are historically can be targeted in political systems. Like we're in here in New York, over the years, there's been a substantial number of people I've seen who are Jewish and had left Europe or before the war, or had survived in Europe. And I hear people saying like, "Oh, everybody thinks it's fine here in America," but that's what they said in Germany, uh, and we know how that turned out. So there are people. These political things added to the whole COVID thing have made people feel uh, more vulnerable. Um, and then just people just hurt because our country, we have two parties and people, or at least, and we have people who are really hurt, whatever your political persuasion is, that the political figures of their parties have been attacked in a way that really is hurtful, whether you're on one side of the political spectrum or another, and it really is hurtful, and the discourse has got. So I hear that is part of this in a way that you can't just disentangle it from people's personal problems and the COVID thing. What's happening now is we're part of that historical thing too, which I think has been very hard. So then what about dementia and COVID? Now, for some of you, you may have cognitive problems. For some of you, may be providing care to people with cognitive problems. And so some of the people that I see have relatives who are providing care to their relatives, and that adds another layer of complexity. For those of you who provide care, uh, there are many stresses and many rewards too of providing help to a family member who has cognitive problems. But this confinement is for some people has been so much more difficult, not only for the individual with cognitive impairment, but also for the family member who may have been providing care. Um, for people with cognitive impairment, um, engagement with others and having social stimulation is, for most people, helps undergird people's moods, regardless of their cognitive status. One of my colleagues did a study years ago working with family members of individuals with dementia who were depressed. And so you think, like, what can you do about that? What she basically did is she worked with family members using basic behavioral principles, which were to essentially raise the level of activity for the person who is depressed and a cognitive impairment, um, and um, which may be engaging in exercise or walking or taking part in community programs or engaging in other kinds of things that brought them in contact with other people. Um, and she found that what sometimes we call behavioral activation was related to not only the improvement in the mood of the person with dementia, but also the caregiver. So now we have a situation in which the opportunities such as that are much more limited, right? So although the person with cognitive problems and their caregiver or caregivers were able to see friends, see relatives, engage, and the caregivers go out and have some respite time and do things, that just has not been very easily available. Then there are what we call Dementia Day Programs, which are not available everywhere, but they are some places where the person with dementia can go and have a socialization experience in a program developed designed for them. But many of those programs couldn't have people in person or maybe close. Um, for those of you who have people coming into the home to provide help, I'm sure more than one of you thought, is that such a good idea? Is that home health aid possibly infected? Is it possible that we could infect that person with COVID? Um, how do I handle that situation? Um, and then there are people who have AIDS who did get sick and couldn't come because they were sick and maybe couldn't return to work. So there's the whole issue of someone who has the vulnerability of cognitive impairment now having to deal with the real threat of picking up something. Then of course there are people who are in nursing homes. Well, I'm sure you all know the story on nursing homes, which has been these are highly congregated environments with people with all sorts of vulnerability, in which we've seen some of the largest rates of COVID. Plus, um, all the restrictions on access to people in nursing homes by relatives, or only can do it by remote means. That's been complicated. For people who have cognitive impairment, they may not understand what's going on. They don't know why they can't go out. They don't know why they can't see their grandchild. They don't know why they can't go to that program. And some people may, even if explained, can't really grasp what's going on. I mean, frankly, for all of us, it's hard to grasp what's going on, right? And then there's the challenge of these virtual technologies. It can be confusing for some people with cognitive impairment of understanding that they can look in the screen and actually be talking with somebody, and begin to confuse what's real and what's not real, and to try to attend to this thing. I mean, that has been a big challenge. So I mentioned those things, and I'm sure that many of you can give me many other examples, but that's another layer of complexity on this. So as is my responsibility on this presentation, I'm supposed to offer you some tips about how to handle things. Well, here are some ideas, right? And I'm not the reservoir of all knowledge about this, and probably many of these you could have given yourself. But here are some things I wrote down. Try to be adaptive with this technology stuff. You know, I've heard people say, I hate Zoom more than anything else in the world, but I do it. If you always were used to getting together with people in person, I hear people say, if I can't get together in person, I'm not going to do that. Maybe you want to be a little bit flexible, and most people have been. Remember the telephone? Well, I mean, I say that as an older generation person who um, seems to use the telephone more than the younger generation people. Um, I would say get out as much as you can. I try to take a daily walk each day if I can. I know I feel better. I get moving, my body feels better. I feel more alert. My mood is improved. And there's this lethargy that sets in with this COVID thing. I don't know about you. I got a pile of books. I thought, oh, I'll read those books during the COVID thing. And I don't know how many I've read, 2, and I should have read 20. And other people have said that, like, how come I'm just in the state of like shutdown? I think it's helpful to be aware of your mood. That is, I think it'd be helpful to be an observer of what's going on and how it's affecting you. In the psychotherapy that I do, called Interpersonal Psychotherapy, we ask people to do a weekly a depression rating on a scale of 1 to 10. How strong is your depression? 10 being the worst. It's so interesting simply asking people that each week and then asking them what went on. It can be revelatory of the things that are going on in their lives that are can be increased risk for depression or a decrease in depression and improvement in mood. So sometimes that seems to come out of nowhere, but there's pretty strong connections between what's going on and what you're doing, how you're feeling. And I think the practical import is that then you can figure out what are some options to do something about the things that make you feel worse, and how to do more of what you I think keeping in touch with other people. I know that seems obvious, but I also sometimes find that people are just like the lethargy sets in and they're not making those connections. I would say avoid 24/7 news. Don't sit at the TV all day listening to the next report about the next terrible thing that happened. I think you need to titrate your news, and maybe find other media which you can use that can be more mood elevating. I don't know. I started listening to classical music instead of the news channel, and I found that was really helpful for myself. Find things to occupy yourself. Try to have a bit of a plan each day. I had a guy I was seeing. He said, "You know what? This is what helps me. I have one thing I have to accomplish every day." And I set that up, and when I accomplish it, it may be small, but I feel a lot better from that. Think about what life is going to be after this COVID thing is done. I work at a hospital. I got my first vaccination. I am already beginning to plan what I'm going to do and who I'm going to reconnect with. And I feel my spirits have brightened knowing that there are going to be opportunities to now connect with my loved ones. It might be helpful to think about what you can be genuinely grateful for. I hear people say to me like, you know what? I live in a comfortable apartment. I have enough money to live on. I'm not rich. I have family members who care about me, um, and I have a good relationship with my husband. Right. So those are things we sometimes take for granted. But taking stock of what thing. I mean, I for myself say I am so grateful that I have a job during this time and I can do some meaningful work, and that's important. And I'm sure your other things. You might want to take stock of what you've learned during this time. This has been a searing experience for many of us. And I don't say look for a silver lining in this. Although people have found things, people have gone closer to others. They've spent time with themselves. They've given them a chance to some things out for themselves in their lives. They begin to understand what was most important for them in their lives, and that may inform what the next steps will be in their lives, which it may involve a deliberate decision to make changes in one's life in a way that the pandemic has revealed more clearly than would have been the case if there were no pandemic. So finishing up here, so some of you may be interested in getting mental health services. They're chiefly online these days, but eventually we're going to be returning to in person. I'm not someone who says, oh, you got to be in therapy, but it can be really helpful for some people. And you have to be the judge about whether things have gotten to the point where it'd be helpful to talk with someone. But the way I approach it, I basically do time limited therapy with most everybody, which is figure out what the issues are, identify what the goals are, make a plan, and then decide how long we're going to meet. Most people I work with found it helpful. Maybe they were just telling me that, but I think it's the case. The problem is, where do you find mental health services? Depending on where you are in the country, it can be tricky. One place I would say is just a general thing. Each state and region or city has its own area agency on aging. An area agency on aging is a federally funded program for information and referral and other kind of services related to aging. You will have one in your area. And if you Google, and if you Google an area agency on aging and put your city or your county, you'll find that agency would probably be a resource, and helping to identify what mental health resources or other resources for that matter that would be available in your area. So you might want to consider that as a possibility in a way if you're feeling that it's all being a bit much. And I hasten to add, getting support and kindness and care from family and community is also a very powerful ingredient for helping to improve our well-being. So that's what I have to say, and I think Kara was going to see if there are any questions, and if so, I'd be happy to at least tell you what I think.
Yeah, so we do have this is a chance if you guys have questions you want to ask Dr. Henriksen about things that are going on for yourself, maybe if you're having clients or things like that. So we do have one person who wanted to ask you, do you think many people, at this time are more tired in general, even if people who do not have depression?
I would say that if you're not as physically active as you were before, it would make sense to me that you could feel tired. And there's an emotional exhaustion that has come with this whole thing for many of us. Um, and that fatigue may be part of just lack of exercise, lack of engagement. But again, I just hear over and over again people saying, I have all this time on my hands and I just am not moving, literally or figuratively moving things along. I just sort of sit there and I don't know, I hear people that watch TV or, just sort of veg out. So yeah, I think that could just be part of just the stresses of what we're all
Mm-hmm.
contending with.
Mm-hmm. If I have someone who said if they're struggling to find space for themselves because they're actually living with their person who has Alzheimer's and dementia, what are ways they can cope if they don't get a break from their person as much as they would? So it
Yeah,
seems this person used to have a home health aide, and because of COVID, they stopped having this person come in.
I see. Yeah, it was funny. I was talking to a guy today who does have a home health aide who comes in and yet finds himself staying at home more than he really needs to. And we were working together
Mm-hmm.
about figuring out ways. I said, "So what? So what do you find improves your mood? Taking a walk, going to the grocery store." I said, "Fine." So I said, "Maybe you go to the grocery store. You could add some additional time while you're out at the grocery store to walk around a bit and just get a break." Um, so it gets more complicated, of course, if you're living in one place and you don't have anybody who can provide respite. I mean, what comes to mind is there anybody among your friends or family who might be able to come over even on a weekly basis
Mm-hmm.
to give you some respite. Depending upon what the situation is with the relative, is it possible there's a place in the house or the apartment you could go um, and do something that entertains you, whether I don't know, watching a movie or doing stuff on the internet, or reading a book or listening to music and things, if it's feasible to leave the person alone. But I mean, this is the part of the problem under these current circumstances. People who had AIDS
Mm-hmm.
don't. People at day programs don't. People who would have other arrangements that would get both of them out can't. Um, and so all I can just say is um, try to keep in mind that the COVID vaccine is being distributed now. I don't know in your part of the country where it's happening, but here in New York, people 65 and older are getting vaccinated. There are all sorts of problems with distribution, no doubt about it. But try to imagine how you would what your life will begin to look like when in fact things become more relaxed around this COVID thing, and what are the things that you can imagine you'll be able to do that you're not currently able to do, you know?
Mhm. Mhm. Definitely. And then I have someone else who asked, what would you recommend for persons if they have Alzheimer's, they might be advanced? What can a person do with them in order to keep them active or engaged? Which I think you touched on a little bit there in trying to keep more
Yeah.
activeness as possible.
It probably depends upon the person and what is engaging for them. I remember early in my career there was a book on on it was a whole book on things that could be that people with cognitive impairment could do. It was called Doing Things. I think that was the name of it. And I was just so intrigued that somebody could come up a book worth of things that could be that could be done. So you would probably have to figure out what could be engaging and what the person would be able to do. I have a friend whose mom I just dearly loved, who had dementia at the end of her life, and she really was feeling bored around the house, and she loved to fold laundry. Right? She just felt like she was contributing to the thing. And her daughter would say, "Mom, can you help me fold the laundry?" And then,
Mhm.
oh, her mom loved it. And then the daughter, you could argue whether she should have done this, would go and unfold it and say, found a whole bunch more. And so at the end of
Aw.
her mom just felt like just so proud that she was contributing to the household. And maybe there are other manageable things that could be done that could give the person a sense that they're making a contribution.
Mhm. Mhm. And I definitely agree with that. And it's kind of like trial and error and seeing what helps with our person and gaining their interest and seeing it which ways that they can contribute because they still can.
Yes.
And it's
Yeah.
just figuring out different ways to go about it because of the restrictions that are there.
Yeah, or setting the table, or I don't know if it's safe. We're doing some preparation of
Mhm.
some piece of preparation for the meal, so that the person can feel that they did something, or making the bed, or whatever is feasible to do, because I think we in the end all of us want to feel like we're part of something and that we're making some contribution. And if you do, depending on the degree of cognitive problems, that may be more limited, but there are still things that can do. On a personal, my mom at the end of her life was in a nursing home, and which was a hard for her to get her head around. But when she did, she was in the nursing home for 9 months. In the last 9 months of her life, what she did was try to make the life for the other residents of the nursing home better, because she was generally cognitively intact, and then befriended people and showed concern and care for them. And she got as much out of that as anybody else did. So, I just remember, that and how impressed I was. And so there are lots of ways of trying to do things, even though they may seem limited and small. Sometimes the small things are big.
Mhm. Exactly. So I do have another question. So this one is, this person's a caregiver for their mom. Unfortunately, they had to take her car away because it's, not safe. So she wants to know, because of the mood changes she's seeing, is there grieving stages during this process, and is that normal to grieve if you're losing something?
Oh, well, yes. I mean, yeah, I don't know. I don't know if there's stages, but I would say that as part of life transitions, of which there are so
Mhm.
many,
Yep.
feelings about about the fact that life is not the way it had been. And so I would say that if you're a person who was used to driving, got pleasure from it,
Mhm.
you were a good driver, gave you a way to get to things,
Mhm.
to be told that you can't drive,
Mhm.
that would bring up feelings. And I don't
Yeah.
know. I mean, what and how could you I don't you know what when I work with people around the life transitions, it could be like, "Oh, now I have serious medical problems. I used to be healthy. I thought of myself as a healthy person," right? I give people space to talk about how sad they are about that, you know?
Mhm.
And acknowledge. I don't know, if I had somebody who if I had a relative who was driving and it couldn't, I would say, Mom, this must be so hard. I'm thinking of my mom. Oh, Mom, this must really hurt. You drove. You were, of your generation, you were one of those women who's on the road, and did that, and you were such a good driver, and now you can't. I mean, how do you feel about that? Just give people space to talk about it, right? And empathize. Like, I feel mad, I feel sad, I feel aggravated. Just to say to a person, "Oh, that makes perfect sense. I understand why you would feel that way. It must be so hard." Instead of like, "I told you you can't drive. It's not safe." Well, that may be
Mhm.
true, but it's also true, like, that the person is grieving that, and to give them space to do that. Most people are able to move on, but before you move on, you're not. I think you need to look back at where you were and what it was, what you liked about it, and maybe also what the downside was. Yeah, but then you had to drive dad all around all the time because he didn't like to drive. And remember, the neighbors who always got you to drive. You maybe help understand that driving was not all pluses. you know, Boy, wasn't it a
Mhm.
hassle to go to the garage? That garage guy, he was so ornery, wasn't he, or whatever it was. And so you sort of see it a little bit more broadly too.
Yeah, and it's also, especially let's say, because someone just kind of tapped into that question, if, driving your person around was one of the ways that you actually helped to soothe them, and now you're not doing that because of COVID, right? We
Uh-huh.
want to pay attention to the fact that we now have to look at a new coping method because you're not able to drive that person around if it was something that was soothing for them, or see if there's a way you can try to encompass it if you feel comfortable enough and make it as safe as possible if it's something that would be really enjoyable and limit the amount of time potentially. And maybe instead of once every day, try maybe once a week so it becomes a treat or something. Um,
Yeah. So I mean, humans are by nature are resilient and adaptive, I believe, right? But each of these changes, requires um, uh, emotionally getting your head around what has happened, right? You have we have emotional reactions, and then beginning to think about what are some options for your new situation. I see this all the time with older people, all the time.
mhm.
I mean, I see it's just like, medical problems are just so much part and parcel of aging. And
Mhm.
so what do you do? I can't walk to where I always walked to before, right?
Mhm.
Well, where might you be able to walk to? You know, I I don't I need a cane now. I hate having a cane. Then what do they think? I'm an old person? And then it's like, okay, well, you can weigh it. I mean, is it worthwhile for you to get out and have the perceived stigma of having a cane, or not? You know, I need a walker, right? Well, I know it's a hassle to go out with a walker, but in the end, maybe that's going to give you more independence than if you didn't do it at all. You know.
Mhm.
Anyway, life presents new circumstances regularly and sometimes dramatically. Can you imagine what it must be like to,
Mhm.
yes, you could, to 18, finish high school, and then have to go out in the world and make your way in the world? I mean, we don't give young people enough credit for all they have to deal with in life. Their life changes.
Mhm. Yeah, trying to do different. Now I have someone here. She kind of asked like, a utopia kind of question. So, Dr. Henriksen, if you could have a wish list for, patients or just, anyone in general, money not an issue. What kind of supportive services, do you think you would provide for individuals trying to one cope with COVID, but also if they're coping with COVID while having a cognitive impairment?
The wish list. I didn't understand. What is the wish
Oh,
list
sorry.
that I?
Yeah, so you as a professional, as a gerontologist in this field, what are things that you think that if you could have like a list of services for anyone, no matter what do you think would be the top kind of resources that would be helpful to have
I
for
I
those?
I I would say get a COVID vaccine. That's
Mhm.
what I would say.
Mhm.
because
Yeah,
because with that things are going to open up for you, and hopefully for the broader community to be able to resume things. That's just going to open up space in your life to be able to safely do a whole variety of other things, even though they may be limited, depending upon what your cognitive status is. Nonetheless, there's going to be so much more that you can do. If I were to, I'd put that at the top of the list.
mhm. Exactly. And so with that, we have no more questions. So we'll wrap up for today as it's 2:00. So I just want to say thank you so much, Dr. Henriksen, for being here with us today and, providing this opportunity for others about this. I'm already getting comments about saying thank you so much. This was really good. For someone who mentioned about the recording, we'll have it on our website, so something you can watch again. Thank you so much. Excellent session. Very happy with it. So, yeah, I
Good.
completely agree. Without further ado.
So all the best to everybody. I think the year is going to be much better than last year. And as Jesse Jackson used to say, keep hope alive.
Yes. Fingers crossed. I hope everyone stays safe. And if anyone's looking for resources or connections, just let me know. I can always connect with Greg as well. Okay?
Okay, good.
Take care, everyone.